Greetings, everybody. Thank you for joining us today. My name is Chioma Inaji. I'm a program director at the Multicultural AIDS Coalition here in Boston, Massachusetts. We're excited to be having this panel discussion and conversation with you. This might be your first time joining us, or you might have joined our other two webinars that we've had. And we choose to start our time together in a moment of standing still, being at peace, and just a moment of reflection. We all are busy. We have a lot going on in our personal and our professional and our work and our communities, and it's just been heightened with COVID-19. And so the organizing group of these webinar series, we just decided that it's good for us to start every webinar with just pausing and taking a moment and taking a break for ourselves. So I'm going to invite Max Boykin from Black AIDS Institute to please guide us in a mindfulness exercise that will support us in engaging more as we spend time together today. Max?
Thank you, everyone, for joining us today. I know this has been a trying time for many of us that are on this call, and this has been a hard time for the world. And we understand that there are many ways that we can pay homage to those that we have lost, that have been highly impacted by this. But there's also time for us to just sit before going into this deep, hard conversation around what our communities have done. We really want to just take time to do some mindfulness. This one is called the 5 Senses exercise. If you are willing and able, go ahead and close your eyes. Now please open those eyes and notice 5 things that you can see. Not necessarily looking at the computer at this time. We'll have plenty of engagement on the laptops or a computer that you're on right now. But look around. See what else is in your office today or your space of work. If that's your living room, if that's your office today, just noticing something that maybe you have not noticed before. And notice what those 5 things are. Now, notice 4 things you can feel. It could be the pencil at your desk. It could be the laptop. It could be the bed that you're still sitting in. The carpet that you're laying upon. It could be your kid on your lap. Now notice 3 things you can hear. Thinking outside of my voice. If it's maybe some bacon or kale crackling in the background. It could be the street outside. I can hear 285 from my house. It could be the silence or near silence or just the air starting to rubble on to keep you hot or cold, depending on the weather outside. Now, notice 2 things you can smell. Enlarge the nostrils. Think about what you're smelling in. Breathe a little bit. Lastly, notice 1 thing you can taste. It's the air. It may be a little bit of the coffee or food you had earlier today. Now, if you're willing and able, please take 1 deep collective breath in. Let it out. Just 2 more times. Take 1 breath in and let it out. And for this last one, take a deep breath in, and on the way out, let whatever noise, feelings that you're having, and let them on out as well. 1, 2, 3. Breathe in. And let it out. Let whatever you're feeling, whatever's on your shoulders right now, go ahead and let them out. Thank you all for joining us today, and I will kick it back to Chioma. Thank
you, Max. I always appreciate those moments of being still, and appreciate them more when we're able to do it as a collective. Again, my name is Chioma Nnaji. I'm a program director at the Multicultural AIDS Coalition in Boston, Massachusetts. I would like to welcome you again to this webinar. It's a part of a webinar series on conversations on COVID-19 in Black communities. This is our 3rd webinar series. And today we're going to be talking about organizing for ourselves. Black communities take action on COVID-19. I'm very excited about this topic because we're going to have an opportunity not to only talk about what's happening in our communities, but also talk about the ways in which our communities are responding, are resisting, and are actually taking care of each other. But before we get started, another thing that we like to do as part of our webinar series is provide a clinical update. And we find that in our webinars, folks are asking a lot of questions about sort of the information that's out there around COVID, around how do you protect yourself. And so we want to be able to share information and accurate information so that you can continue to educate your communities. So I would like to welcome Dr. Priscilla Ojikutu, who will be sharing with us our clinical update for today.
Thanks, Chioma, and hello, everyone. Welcome to the webinar series. I always enjoy being a part of this program because it's an ongoing conversation. So for this clinical update, I was asked to comment about why we should continue physical distancing. I mean, we've been doing this for a number of weeks. I know people are tired. And on top of that, states throughout the country, quite a few states are reopening or have reopened to a degree. Interestingly, many of the states that have reopened, are actually still seeing their case numbers increase. And this is very problematic. They are making the decision to open, but they're not taking in to account some of the clinical, medical, public health ramifications of reopening. And most health experts agree that reopening right now is premature. They looked at data as to what will happen if states reopen right now, how many deaths we'll actually have by sort of the end of summer. And it's over 135,000 if we continue to reopen. The point is that the virus is still out there and there isn't enough immunity right now. So there's no herd immunity. We talked about this before. So that would mean that a large portion of people have been exposed to the virus and they have antibodies to the virus that we know are effective. And we actually don't know the antibodies, how effective antibodies actually are. And we don't know that there are enough people who've actually been exposed. So I think that it would be in our best interest to wait and to continue to do physical distancing until the curve, in terms of the number of cases rising and going down, until that curve is sustainably flattened or decreasing, because it's just not quite there yet in a lot of these locations. I think one of the reasons that I was asked to talk about this particular question is because a lot of the reopening is occurring in places where there are a lot of us, a lot of Black people. And given what we know about the increased number of cases amongst Black individuals and the increased comparatively speaking, the increased mortality in Black and Brown individuals, I really think it would be in our best interest to be very careful at this time and to realize that not all decisions are made in our best interest. So irrespective of your own medical history, irrespective of your age, I would continue to practice physical distancing. The second question that I wanted to bring up was actually something that I am concerned about. You know, over the course of these last 2 webinars, we've talked about the symptoms of COVID-19, and I think that I've tried to be very clear about the fact that it's primarily a respiratory infection, and in the vast majority of people, it's not severe. You experience fever, ache, sore throat, cough. If things have gotten a little bit worse and you have some shortness of breath, respiratory distress. You can also experience a number of other symptoms like diarrhea, nausea. We've talked about some of the neurologic manifestations when Tito Jackson was on, headache, loss of taste and smell. But as time has gone on, we've learned more and more about COVID-19, and we've learned a lot about different manifestations that can come up. It's almost like a new thing at the hospital. Every week we talk about different cases and what we're seeing. And one of these manifestations is concerning, and I wanted to mention it specifically to this group for you to tell other people about it, because I think it's something that we can prevent the long-term ramifications of. So what we're seeing is that with COVID-19, there's an increase in blood clotting. And you've probably heard of people having blood clots, either in the veins, less commonly in the arteries, and they can be all over the body with COVID-19. We're not exactly sure why that happens. It could just be the virus attacking blood vessels. Who really knows? I don't think anybody understands that yet. But one of the reasons why I'm concerned about it is because there have been some case reports of stroke complications in younger people who've been infected with COVID-19. And what does that look like? So basically, it would be blockage, oftentimes of the large vessels in the brain, and one would experience slurred speech, confusion, drooping on one side of the face, weakness in one arm, and we think that that's caused by this blood clotting thing that's happening with the virus. The reason why I'm mentioning this is because it's been noticed in younger individuals, and what's happening with younger folks, I think in some cases, is that they're developing some of these respiratory symptoms and they figure, oh, you know, I'll be fine, and they're, you know, staying at home, and maybe they're experiencing some of these symptoms and thinking, oh, you know, I feel a little confused, you know, maybe I'm drooping, who knows, and then they're just letting it go. They're not, you know, getting medical assistance. They're not calling 911 to get help. The problem there, obviously, is that these could be symptoms of stroke. And if you come into the hospital soon, somebody can actually intervene. So something can be done to stop it from progressing, stop the long-term ramifications of stroke, especially if this is in one of the large vessels. So large strokes, they're treatable, but the intervention needs to happen quickly. And the symptoms, slurred speech, confusion, drooping on one side of the face, weakness in the arm, they're things that we need to think about, especially if you are somebody who's not able to do the physical distancing, still out there, maybe being exposed, you're an essential worker, you may develop some respiratory symptoms a few days later, then you develop these neurologic symptoms, the symptoms that I've mentioned. Call 911. Come into the hospital. I know it can be scary to come into the hospital at this time, but come into the hospital and get treatment. So tell your friends, tell your family members. This is something that I think we're going to see more of. So I just wanted to put that out there for people to be aware of. So thanks, and I'll turn it back to Chioma.
Thank you, Dr. Ojikutu. Thank you. She will be hanging around on the webinar. So if you have any questions about what she said, please go ahead and put them in the webinar chat box or in the Q&A, and we will hopefully be able to get to them by the end of this webinar. So before we move on, I want to acknowledge who our sponsors are. We are a group of organizations and individuals who have come together to put on these webinar series. Black AIDS Institute, the Multicultural AIDS Coalition, House of Blahnik, Harvard University CFAR, and Southern AIDS Coalition. So thank you, each one of you all, for joining together to ensure that we are amplifying what's happening in our communities and the needs of our communities. So I want to turn it over to our panelists. How's everybody doing?
Good.
Good, good, good. So I'm gonna ask you all to introduce yourselves. And as you're introducing yourselves, please, of course, say where you're located, but give us a little bit of information about what's going on in the particular communities that you are activated in and that you're doing work in. And I ask, Rosette, do you want to go ahead and start us off?
Yes, I can start. That's fine.
Great, thank you.
How's everybody doing? My name is Richard Wallace. I'm the founder and executive director of an organization in Chicago called Equity and Transformation. We're founded in 2018 by formerly incarcerated people from Chicago to uplift the faces and voices of the vast disenfranchised and unemployed community in Chicago. Our mission is to build social and economic equity for Black Chicagoans engaged in the informal economy. And folks don't know what the informal economy is. Essentially, it's how our people have been making lemonade out of lemons all our lives, right? When we go to the job and we apply and we have a background, they tell us no. We figure out a way to create capital to ensure that our families are still fed and there's a roof over our head. That's essentially what informality is. It's a wonky word that describes a lot of things, but it hasn't been applied in a real way to understand the conditions of Black folks in the U.S. So seeing that, right, I think some more tangible examples of the people that we organize, we think about Eric Garner, who was killed selling loose cigarettes. He was an informal worker. You think about Alton Sterling, who was killed selling DVDs. He is also what you would consider an informal worker. If you think about the countless trans and cisgender commercial sex workers that are killed in the US every year, you are talking about informal workers. So we build comprehensive campaigns on and with and on behalf of Black informal workers. Most recently, we won a campaign around cannabis equity in the state of Illinois. So that's a little bit about who we are and what I do. I think, do you want me to go any deeper for this first round, or do you want to just kind of like an introduction and what
We'll come back to you, yeah. That was a great introduction, thank you. So Gina, can you go next? Southern AIDS Coalition?
Yes. Hey, I'm Gina Brown from New Orleans. I am the community engagement person at the Southern AIDS Coalition. SAC is based in the South. We do all of our work in the South with a focus on the rural South. We work with people living with HIV. We also are grant makers and do a whole lot of other things. My role at SAC is to educate people living with HIV and to really be engaged with the community at large. The biggest challenge I'm seeing is the fact that we can't connect with people. Most of our work happens in the rural South. So, you know, there's a huge disconnect when it comes to internet and telephones and different things like that. So we're not able to stay connected to the people we're working with. And that's the biggest challenge right now.
Thank you, Gina. Rosette, are you ready now? Go ahead and tell us who you are and what is some of the community work what are some of the barriers, that your community is dealing with during this time of COVID-19?
I am Rosette Serwaga, and I am representing an African organization, AMAC, Activated Massachusetts African Community, a group that was formed actually at the beginning of this year to work on something very different, but has found itself involved in COVID because it had to. So it has, it is, working as the clearinghouse for African communities in the Boston area, actually in Massachusetts, but mainly around the Boston area. There are groups doing different things, trying to reach the different communities. The Zambian group, I think, is usually doing the Zoom meetings, calling in just to check to see if people are well. The Somali group also is reaching its members through phone calls and Zoom meetings. Then the Ugandan community, which I'm very involved with, has done a bunch of things. They have come together, made donations. You know, individuals have donated to this cause to try and deliver food to the people who are sick. Most of the people in the community actually are frontliners. They are CNAs, they are nurses. So a lot of people have been infected and affected in our community. I think, I don't know if this is an overstatement if I say, I think the Ugandan community has seen most deaths due to COVID-19 in the African communities altogether. Because I think like in 1 week we had 3 people that died that we had to bury. And some of these things are complicated by people who are undocumented. So they don't qualify for most stuff. They don't qualify for the unemployment. They don't qualify for food stamps. They don't qualify for anything. So really the community members are the ones who come together and help them out. So today, actually, I am off. You know, I have reassigned my people a day in different towns. We've gone as far as Worcester, but my runs are usually in Waltham, Belmont, and Woburn. That's what we're doing, Choma. Do you want me to say more? Do you want more?
We definitely have time to get more into it. So thank you. I mean, one of the things I respect and appreciate about this panel is that not only are we representing the diversity as it relates to geography, but we're also representing the diversity as it relates to Black folks, right? This idea that Black folks look one way, talk one way, have one experience. I think through sort of what you have talked about in terms of who your community is and who they represent, we can definitely speak to the ways in which our communities intersect with multiple identities, but also the ways in which our communities are dealing with COVID in some unique and challenging ways. So Rosette already started talking a little bit about what's happening in terms of the African immigrant community in Massachusetts. Richard, do you want to talk a little bit about what EAT is doing, particularly in Chicago, to address some of the challenges and the barriers that you talked about? And particularly, what are these community-led strategies that are happening in Chicago?
Yeah, so again, my name is Richard Wallace, and I think in the beginning, I think like most of us, when we heard about COVID-19, I think we felt like it was a ship that was far, far, far away from our community. And in the beginning, we didn't really see much imagery that supported different narratives that soon became paramount in our community, but we didn't see many narratives around the disproportionate impact that this virus would have on Black people. I can remember being in conversations like, oh, yo, we immune. I ain't seen no pictures of us in the news, it ain't us. This ain't for us, And that slowly began to dissipate as the numbers started to come in. And in Chicago, 70% of the COVID-related deaths were African-American, right? So, and this is a big city. We represent 30% of the population, somewhere around there. So you're talking about a large number of folks who have passed away due to COVID-19. And that's just in line with the other deaths, right? So you talk about high blood pressure, you talk about HIV, you talk about incarceration. There's so many different, it just added another layer on top of all the other conditions that were pre-existing before COVID-19. So immediately I started seeing the news, and what the news was saying is stay at home, self-quarantine, paid leave, work from home. All of these narratives were popping up about specific interventions that needed to be made on behalf to support US workers. And I said, well, what does that mean for a city where you have one of the highest rates of Black unemployment in the nation? What does that mean for the historically unemployed populations? How do they get access to these much needed interventions when they can't file and they haven't filed taxes in the last 5-10 years? When they owe child support, when they're, you know, all of these different, you know, nuances that ultimately do make up our body as Black folks, right? Like how are all of our folks going to be actually included in this? And so I immediately was like, they're not going to include us, right? Let's just think and move and operate in a way that they're not going to include us. So I made a call to a few of my comrades, and to shout out, because there's nothing that ever happens in silos. Almost everything that Equity and Transformation produces, it comes with the wisdom of both our ancestors and other folks that are in the work right now. So I called Charlene, who's also from Chicago, Charlene Carruthers. I called Martine, who organizes a group called U Medics. I called Marlon Chamberlain, who works with formerly incarcerated people in Chicago. And I said, we got to do something. So we ended up putting together this life kit. We called it, at first we were going to call it a survival kit. And they're like, no, our people got to do more than just survive. You know, we got to live in this moment. So we're going to call it a life kit. And that life kit included a number of different pieces. I think so I'll briefly go overview the life kit. It was, we wanted to introduce community care as an alternative, right? Because we felt like the Cook County Hospital would be overburdened. And so we had to have like, what would an alternative to healthcare actually look like, that was focused on community care. So in the life kit itself, it included a whole lot of stuff, right? One of the elders was at the grocery store, and she said, I seen this sister with a car full of ramen noodles and hot dogs. And I was like, no, baby, let me tell you about these recipes. So she started talking about the recipes that she wanted to include, because she came up poor in the South, and her family was able to survive off very little money, off three things. She said beans, rice, and cornmeal, right? So she's like, we gotta reclaim our history, our culinary history, our culinary survival history. So she put a bunch of recipes together, and it was like $2 a plate. You know what I'm saying? Like, you can make these meals at $2 a plate or less, right? In addition to that, we were like, we need to get the resources directly into the hands of folks that are most marginalized, who will not receive relief through the stimulus and the CARES Act. So we put up a GoFundMe and raised about $6,000. Shout out to our board member, Barbara Ransby, who was like, we will do it. And within 48 hours, we were able to raise $6,000. And then we ended up going in the community and buying gift cards and handing out gift cards directly to those folks. And the last piece that we included in the life kit was a pod map. So some folks may be familiar with pod mapping as a restorative justice practice. We took that pod mapping and tweaked it a little bit, so that we can show the impact and try to rid our community of that rugged individualism that capitalism sets on our souls, right? Like, it's just about me. It's not, right? And through the pod mapping, if you're familiar with a pod, it's like a little circle, then there's a bunch of circles around it. If you're the middle circle, that's you. And then the outer ring of circles are people that are in your network that you call on in emergencies. And the bigger one is like institutions that you call on for support. So we're like, if you get COVID, right? So after they filled it out, we said, if you get COVID, your entire pod gets COVID, right? And then what happens to the institutions that you do depend on? If everybody that's in your pod shows up to Cook County Hospital at the same time, what will that level of care look like, et cetera, et cetera? So we did that. And in exchange, you get the gift card, you fill out a pod map, we have a little conversation about the impact of COVID-19 and try to break away some of that. And then we also realized that we're dealing with the ghost of Tuskegee in a real way. So we wanted to put the facts about COVID-19 into something they could take home with them and share with their friends, their family, whatever. So we included like up-to-date information from the CDC around COVID-19, around COVID-19. So that's one.
Thank you. I mean, there's a lot that you said in terms of strategies that people can think about in their own communities. And it's important for me that we amplify and uplift those, and so that individuals can think about, look, so there's the same issues that are happening in my community. What can I do, right? This is the main reason why we're doing this. Folks were asking, okay, we know what's going on. We got that. We need to know what to do. And so I want to amplify some of the things that you said around listening to your elders. Like that's deep. You know what I'm saying? Like listening to what our elders know and what they have been practicing to take care of themselves, and also to maintain our traditional practices that we have, traditional in whatever sense in terms of the diversity within our African community. You talked about even the reframing that was critical, right? So this ain't about survival. This is about us living. and ensuring that we are going to be here for the next day. So even that reframing of the booklet and the toolkit that you talked about, I think is powerful. And then, we got to build our own resources. The GoFundMe has been a crowdsourcing tool that a lot of folks have used, and you are using it, and I know other communities are using it as a way to build our own financial infrastructure. So I thank you for sharing those. I know you're going to talk more about what you're doing, as well as sort of the collective community organizing that's happening. I know, folks are doing their own individual direct action work with political representatives or others who they know can make change in communities. So Gina, I want to offer you space to talk a little bit about the advocacy direct work that you're doing with some of the politicians in your state.
Yes, thank you. In Louisiana, as you know, we are really hard hit with COVID, but we're also hard hit with HIV. So we have those two things going on. Our governor has taken a real strong stand on this COVID response, and he's using a lot of people from the HIV community. So that's one thing he realized just in talking with him, that the HIV community had a great response to HIV. And it's something that other people can replicate. And even our mayor understands that. On the governor's task force, we have a lot of people that are part of the community. So we have Dr. Earl Benjamin. We have Dr. G, who was one of the first people in the state of Louisiana to say U equals U, undetectable equals untransmittable. We have Ms. Catherine Haywood. She started, one of the founders of Women with a Vision here in New Orleans. So as community people who understand how to organize on the ground, that are part of the task force. And it's just open, so anybody can call in and get the ear of anybody who's on that task force. And we love that, because now you can talk about it. One of the things that I'm most concerned with is, as we start to open back these cities and states, people who are homeless and who are now going to be put out of shelters or hotels that they've been staying in, and they're going back on the street. So they're going back on the street without any protection, and that's one of the things that the governor is really aware of. The mayor is aware of that, and trying to find out how they can help that population. We know that a lot of people who are living with HIV are also homeless. So if you're living with HIV and you're homeless, your health outcomes may not be the best. And if you already have poor health outcomes, COVID is just another thing that can take you out. I know somebody personally here in New Orleans who died from the community, and someone out of New Jersey. Both were long-term survivors with HIV, and COVID took them out. I think one of the things also that we have to be aware of as we start to reopen our economy is that people will soon forget that this is a crisis, and that it's really impacting Black and brown people. So we got to keep those conversations going. And I'm just looking forward to getting back out there, not in a physical way, but I mean, getting back out with the people to help educate them and keep them safe. Because I know if we're not continuing with the conversation and we're not talking about it all the time, people will forget. You go in the store and you see people walking around without a mask on. And I don't want to be like Captain Saver, you know what, and like be slapping masks on people, but that's the feeling I get, because you don't know who's in that store and who may have a compromised immune system. So we have to remember that we're constantly educating people, and we can't stop, and it even goes for our elected officials. I saw today, and I wanted to scream, where Chris Christie basically said people are just gonna have to die so the economy can open back. I'm like, no, that's not how this works, because it's Black and brown people that are dying. We have to keep them safe. And I wanted to tell Richard, every time he goes off and I see eat, I think of Chopped, and I say, is he a chef? And then you say something I know you're not, but I love that.
Gina, I thank you for bringing in sort of, the HIV field and those of us who've been doing the HIV work for a while. You know, the organizing, the sponsors of this, all of us are HIV-focused organizations, but felt the need to have this conversation around COVID-19 because there are similar issues that we saw when HIV first hit the scene. And there are potentially strategies, definitely strategies that can be used to combat COVID-19 that were used in the HIV advocacy world. Do you want to share with us a couple of strategies that you think will be relevant for us to start thinking about implementing or implementing now? There's a level of urgency in this space that came out of the HIV work that was successful in the HIV work.
Don't take no for an answer. That's the first thing. That's the first thing that came out of the HIV world, was that they were not taking no for an answer. So you demand what you need. You know, we need these services. We need such and such, and we need to talk about that. We need to talk about the things that we saw that worked. You know, how we all came together and we educated each other. That really worked. You know, I don't think because, you know, when AIDS first started, it was Ronald Reagan. I don't think Ronald Reagan could have done a press conference and said anything about HIV and made us believe it. You know, so Donald Trump can't say anything about COVID and make us believe it. We believe each other. And that's one thing that the HIV community found out early, is that we trust each other, we believe each other, we get information from each other. So we have to have the correct information, you know, at all times when we're sharing this stuff. And just the organizing spirit. You know, it came from the civil rights era, and then the HIV community harnessed it and made it grow a little bit, and now we can do even better things with it, you know, to look at some of these pandemics, to look at these things and really address them. One of the things I want to say this quickly that I find COVID and HIV have in common is the stigma. The stigma. You know, that feeling of something is wrong with me, or other people looking at you as if something is wrong with you. So it kind of makes you not be as careful as you would be. Because if I'm gonna wear a mask and people are gonna stare at me, then I'm just not gonna wear a mask. And we have to make sure that we're telling people that it's for their good and for the good of the public, you know. And that's one thing, we shamed people living with HIV. We said, positive people, negative people don't transmit HIV. Only positive people do. And we shame them. And we're doing that with COVID. We can't shame people. You know, we have to talk about it as a medical condition and make sure people understand that.
Thank you. Rosette, I know, you know, as we were preparing for this webinar, you spoke a lot about sort of stigma, what Gina was referring to, and also working with individuals who are undocumented. You even talked about that in your opening remarks. Can you talk a little bit about the ways in which some of the strategies that are being put in place to address stigma, address you know, folks' undocumented status, to ensure that they're getting services? Maybe if you want to put forth, you know, a specific case that you all have worked on.
Okay, thank you. So the biggest challenge for us actually has been housing. You know, as far as stigma is concerned, housing. Most people are living in shared accommodation. And there was this the very first case that we got that took us around was a young gentleman who had been coughing, I think, for 2 days. And his roommates were like, you're coughing. You need to get out of here. So the guy had nowhere to go. And then he called our group. And luckily enough, this was later on, actually. So when he called us, I said, you know, okay, so tomorrow you have to go and test, and then we know what we are dealing with. So he went and tested, and we got him accommodation in a hotel as we're waiting for results. And 2 days later, the results came back as positive. And then we called some people in the network. Actually, this person had been introduced to us by Choma. So I called this lady who oh my goodness, did everything to make sure this guy gets what he needed. So he was connected to Boston Hope. I think it's a program that is housing people who are recovering or who are COVID positive. So they got him a room there. But in the meantime, he had contacted his employer, who had said, okay, they'll pay for his time at the hotel. So he stayed at the hotel actually until Sunday. And yesterday he went back to his apartment, and the roommates are okay now with him. So he's back there. But there's so many other people. There's a lady we're working with right now who has recovered and is back on, like she's behind on her rent, again in a shared apartment. And the roommate is putting pressure on her to pay, even if she doesn't have the money. I know they have, I think there's a rule now in Massachusetts that somebody cannot be evicted because of non-payment of rent. But the roommate doesn't understand, and this lady and her child, I'm hoping they don't get thrown out. So I hope we don't get to that stage of being thrown out. But the stigma around the disease, I think people not understanding, really, for me, it feels like 20 years ago when we were doing with AIDS. That's how it feels right now. So I think, if we do more education in our community, and also show them that there's help out there. If you look for it, you can find it. So you're not alone. Don't suffer alone. Reach out to somebody, because always somebody knows somebody who can be of help to you.
Thank you. I'm going to take a couple of questions from the chat. Richard, I think this is a question for you, but other folks might be able to speak on it. What can we do to advocate for people in the prison system?
Yeah, I just want to say two things. One is that I came up I got into organizing, but I worked in public health for a number of years. I did HIV, AIDS prevention, counseling, and testing for 7 years at Westside Health Authority under the leadership of Maurice Chapman. My mother comes from the HIV field as well, Reverend Doris Green from the AIDS Foundation of Chicago, who now runs Men and Women in Prison Ministry. So that work is also is close to my heart. And I've been part of, I've got trained in all the Debbies and Ebbies and all of the different interventions that I think that we do need to recall in this moment, some of the practical evidence-based interventions that work for our people. So I think that is a great idea. I just want to lift that up. And then what can we do for our formerly incarcerated people? And so I think it was about 2 weeks ago, we did a mobile caravan to the county jail. It was a noise demonstration. It wasn't led by Equity and Transformation, but we were in partnership with a number of other community-led organizations that are in the fight around jails. We see the through line between informality and jails, because on the 25th of March, I pulled up onto Madison and Pulaski, which is basically an open air market where a lot of informal work takes place in Chicago. And there was at least 9 squad cars that had all the youth hemmed up. And we were coming there to distribute the life kits, masks, other risk reduction, tools. And the police told us there was a curfew that started at 5 o'clock, and it was 11:45 when we pulled up. So I asked the officer, so why, if there's a curfew at 5, why are y'all out here now? And he then referred to the need for dispersal orders. So we've seen this increase police presence within low-income communities, and we decided to drive down the block after we talked the police down. They let them go. They let them participate. We said they were our members. They were our leaders. Some of them were, some of them weren't, but at the same time, it provided a little bit of protection. And we drove down the street to a place called Wicker Park, and there was a dog park in a field, and there was hundreds of white folks out there and no police presence. And my mind was just like, we have to do something. So then we engaged in the jail demonstration to amplify the challenge. So you're saying that, one, if you can't quarantine or stay at home, then you're under the threat of being arrested. But yet at the county jail, you have one of the largest COVID-19 clusters right, behind any county jail in the nation here in Chicago, right? So you're going to take them out of the streets where they could get COVID and take them to the county jail where they most likely will get COVID, right? So it was like, we can't, it doesn't make sense. It's not logical. You should be releasing our elderly folks. We should be leaving people that are compromised. You should be freeing them all at the end of the day. That is one of our stances. But for now, let's talk about these specific demands. And so you should, for folks that are not, and I think there's a divide between service sector and organizing that has to be mended, I think, at some point. Because when I worked in public health, I didn't know much about how to politically move specific policies. We went to lobby days, et cetera. But for the most part, we stayed out of the political fights. So a lot of the advocacy organizations versus the service sector organizations, there needs to be a merger, because I think right now in this moment, you're seeing people coming home from jails because they are doing some decarceration, but that also need wraparound services in order to be stable once they get released, right? So you're talking about folks coming out, they need ID restoration, they need access to food, they need access to housing. So you're seeing like the housing community come together. You're seeing the service sector come together. You're seeing like food and emergency pantry services coming together in ways that can really treat the need for like decarceral efforts. And so that's what we're seeing in Chicago, is that like, one, they are releasing some people. I think about 1,000 people have been released from Cook County Jail over the course of, since COVID started. Over like 500 of those folks, unfortunately, ended up on electronic monitoring. And then a big piece of the work right now is really beginning to, educate the public about what jail is. A lot of people think that jail is where you go when you're convicted. And in reality, a lot of people that are in there are not there because they've been convicted of anything. They're in there because they can't afford bond or bail, which is a lot different than being guilty, right? So people are being held there for financial reasons. And then if you look at the per capita income in Black communities, you see that who but us can't afford bond during a pandemic, right? You know what I mean? Like, in a very real way, it's our people that are back there, and they're back there essentially because they can't afford bond for a lot of reasons, right? Or they're on PO holds, et cetera, et cetera. So nobody that's back there in the jail has got a death sentence, right? These are people that have not been arraigned, and they need to be. And at the same time, there's a pandemic, and I think that what has been kind of actualized in the current political moment is that the jails and the prisons didn't have the capacity to deal with the pandemic. You've seen officers that were getting COVID-19. You've seen, the doctors and the nurses that were back there that were overwhelmed with the amount of cases. So my solution is not that we need to make better jails, right? My solution is that we need to not hold people in jail due to financial reasons, and we need to free all of our folks that are back there. So if you want to get plugged in, find, and you say, for instance, you're at a service sector nonprofit organization, find a political home at like an organizing institution that holds the values that you hold dear to your heart.
You're definitely bringing up a big issue, right? The criminalization of brown and Black folks. And, I'm looking at the comments and folks are saying, what was happening in New York in terms of the Jewish community having gatherings, and there wasn't a level of patrol. I think historically what we've seen here in the US definitely is the excuse or the allowance of, I call it, state violence on Black and brown folks under sort of the premise of safety and security, right? This is about safety, and so we're gonna lock you up, right? This is why we're putting these handcuffs on you. And we could do a whole webinar on that by itself. But I appreciate you uplifting that and talking about sort of some of the direct actions that are happening in Chicago to tackle the issue of criminalization of brown and Black folks. Something else that you brought up that I want to hear some feedback from, insight from all the other panelists, is around partnerships and getting back to sort of how this relates to what came out of HIV work, we saw that this linkage of care and linkage of services was critical to ensuring that people living with HIV have the support needed in order to adhere to treatment and live healthy lives. And so the care wasn't just thinking about treatment, right? The care was thinking about food, was thinking about housing, and we still have those systems in place. And now we see in this era of COVID-19, that sort of same kind of system playing out. But I want to ask you, are there any partnerships that you think we really need to be thinking about or engaging in that is more critical to what needs to happen in Black communities, right? During HIV, we were focused on making sure we get Black churches engaged, right? But are there any other sort of what HIV might call these non-traditional partners that we really need to be tapping into and building capacity and linkage to for Black folks around COVID-19? Anybody can answer that question.
Choma, I think really, unlike HIV, I think we need to partner with everything that moves. I think we need to talk to the community leaders, the mosque, churches, the individuals in the community. When you think about this group of ours that delivers food to the people who are sick, there's a reverend, there's me, there's two Muslim guys, and people who are also working are part of that group. So like we just come and say, hey, who is available today to do that? And they'll say, yeah, I am. So I think everybody who understands this to be a partner in this, because we need to get resources from everywhere. We can't sit and wait for the government to announce grants that need to be applied for. We need resources now. We can't wait. And so if a community member can chip in, either cook food or give money or provide other supplies that people may need that don't have, I think we just have to do that. And now that we understand about the urgency, we went through the HIV thing, so we know that this is urgent. It's an emergency. We can't sit and wait for anything. We can't do case studies. We can't do, I don't know, whatever needs to be done. We just have to jump in and do what we need to do.
Thank you. Anybody else want to sort of comment on where you think we need to be thinking about connecting to? Someone in the chat said elder agencies.
I think we need to connect to every agency, housing, food pantries, and not just food pantries that's already connected to HIV service organizations, but those outside, because people are in need. In New Orleans, we have a lot of food deserts, especially in the Lower Ninth Ward. That was hardest hit by Hurricane Katrina. So now you have a whole group of people who, even if they get food stamps, they can't go and spend them. So there are some food delivery things that's going on that are for people who are low income. So finding out who those people are and connecting with them, finding out who, and not just the church in your area, finding other churches that you can partner with. Churches that have money, I'll say it like that. Churches that have money, that's who anybody that has money needs to be our partner at this time, because that's the biggest need. People have to pay their bills. They have to buy food. They need toiletries. They need different things. And if you can't go to work and you're not getting unemployment, because we think everybody who's out of work is going to get an unemployment check, that doesn't work like that. So let's be honest, so really connecting to every service organization that you can think of. And if they say no, then go to the next one.
I would also, this like future visioning piece, right? On that question is, how do we begin to provide the resources for ourselves and get in a position where we can do so? I think throughout my history, been on Earth 37 years. It's not a long time, but it's a few years. But throughout each episode, there's a consistent demand for the state to produce enough to really bring about some level of equity for our people. And they never do it, right? I worked in HIV. I remember when the shorties was getting kicked out of Boys Town, and it was ugly. And then we needed access to housing, and the housing was temporary. As long as the problem stayed amplified in the media and the news, you can get dollars. But the second it disappeared from the media and the news, and it was no longer paid attention to, but the people still needed housing. And then there wasn't thought. I mean, I think that because we didn't really, our curiosity about how we could solve the problems that we faced didn't really come to the surface until post. I think we were late to the ball, but I think we can look at COVID-19 and see all of the gaps. Like you said, food service, like food delivery, et cetera, et cetera. Why are we not building those businesses or building those institutions and taxing those institutions in a way that like ensures that people in the community have access to the capital that's generated? So part of me is just like, I also believe deeply in like Black independence, and like, and that is a move to gain power and agency over our health, our diet, et cetera, is to actually begin to build those institutions in our community and like fight back against policies that don't allow us, right? Whether it be because of your background or whatever, to engage in that practice, but that allows you to actually begin to build capital of our own so that we can answer these calls when they happen, right? And not just be like, Jay-Z, yo, can you drop, you know what I mean? Like, I think, you know, Jig is probably getting a lot of calls right now, but at the same time, I think, what does that look like network-wide, like throughout in our populations, like Chicago, New Orleans, whatnot.
But don't we have to reimagine capitalism at that point?
Yeah.
So it's not even just about building our own. We have to like tear this thing down and then reimagine what we want.
Yeah.
I'm there, Richard.
Yeah. I don't even think we got to tear it down because it's already torn down, right?
Sure.
We just have to begin to think, you know what I mean? Like we just got to go in and be like, hey, like we can do this. Like I used to think, I always dream about what it was like to live on Beale Street or like Black Wall Street back in the day. And I'm not glorifying like Black Capital, you know, whatever, but I'm saying like, what would it look like when you go to the shoe cobbler and that person is you? You go to the seamstress and that person is you. You go to the grocery store and that person is you. You go to the school system and that person was you, you know, like, and I think that we're kind of in this pace where we assume the state's going to provide that. I think over the last 60 years, we saw that our schools were dilapidated, right? The same schools that we raced out of before Brown, right? That our schools are in the same condition now because when they left with the capital and left our schools barren. So I think we have to begin to think, okay, well then they left our schools, why don't we take them back, right? And then begin to educate and produce the curriculums that we want to see our children learn from, that build them up opposed to tear them down. I'm done talking.
Yeah, there's a lot of folks in the chat that are just like loving this conversation around, you know, us needing to rethink our own sort of sustainability, right? And, you know, folks are talking about growing our own food, community gardens, right? Like that's the basis, you know, where we get our nutrition is the basis, and being able to grow our own food. A couple of folks said, you know, even our trusted sources in the community are underutilized. Like, you know, Aunt Mary who sits, you know, outside on her porch, right? She's a trusted source in the community, and we're not utilizing her. And so ways in which we engage the social and cultural capital that we already have, and use that to sustain our work, and like Gina is saying, like reimagine what needs to happen, because ain't nobody trying to go back to what it was, right? Ain't nobody trying to go, right? Rosette, you trying to go back to where it was? Nobody's trying to go back to where it was. So how are we reimagining systems? So I want to shift the conversation a little bit. There's a couple of questions in the chat around messaging. And so how are we dealing with the narrative around wearing masks, knowing that in so many instances, Black men wearing masks can be seen as a threat, right? How are we seeing messaging around prevention and folks really understanding the importance of physical distancing? And you know, I don't know if folks are on the news, but you know, the whole thing around Black folks standing outside buying shoes, right? And so, what are some of the ways in which you're sort of seeing messaging being harmful, but what are also the ways in which in your own communities you are addressing the need uh, to change the narrative and educate our community in a different way about what's going on? free Feel free to just talk about messaging in general, and what education do you think needs to happen in our community in order to really address COVID-19 and the ways in which it should happen. Should communities be getting their messaging through certain trusted sources, or certain ways in which are more appropriate for our community and the way that we move?
Well, I think generally, trusted sources are better. I think it's a traditional kind of thing. I remember working with HIV in Africa. The model that came out to be the most effective was the one that was using traditional leaders. Ghana actually ended up adopting that as their national model. The chiefs would go, gather their people and invite somebody who was knowledgeable and tell them about HIV. And that's how the word spread. And eventually Ghana used that as a model, and they were very successful. So I think since, naturally traditional leaders are the custodians of norms and, everything, beliefs, it was effective that way. So also as a trusted person in the community, I think a message coming through you or from you or through you, because you come from somewhere else, through you, I think would be very effective and understood by the people in your community.
There's another question that popped in the chat box. And I think, it's for everybody. Someone asks, how do you convince me my risk of COVID-19 outweighs my risk of racism? That's what I did, Gina. When I read it, I was like, oh. And there it is, right? That's just truth right there. How are we supporting our community in addressing and doing what needs to be done to curtail COVID-19, knowing that the policies and the systems in place are constantly about oppressing?
Yeah, I'll say one thing about this, and I do have to jump because I have another call, but I wrote something about how do I prioritize trauma, right? I had spoken to a young lady, and that was about giving her a mask, and she said, this is like a quote, she said, both my brothers have died in the last 3 years. My mother passed away from a drug overdose, right? Why would I give a damn about COVID, right? And so we also got to contend with the actual conditions pre-COVID, right? That are the underlying issues that COVID's just kind of bringing to the surface. And like our people are for some of our people, it's life or death every day, right? Whether it be police brutality, whether it be hypertension, diabetes, etc. It's like, it's every day. So the amount of trauma that our people consume and the rate, and I think about us as organizers and practitioners, is that like, well, I don't think there's any other population has to hear about trauma specifically to the population that you are, right? And have to provide solutions simultaneous, right? So like, we not only have to hear about the Mike Browns, the COVID-19s, et cetera, we also got to be the face of the fight, right? While we're actually reeling from the trauma of being the victims of the trauma, right? We also have to be the sharpest tool in the deck for the fight. And that burden, I feel like, for us as organizers and practitioners, that we got to be kind to each other, right? In these moments, et cetera, because there's a lot that's at stake and our people are going through a lot. And we do need time to mourn and to really, to kind of like, to let this sit for a minute and be like, yo, how do I feel? Because I didn't feel immediately. I went to work, right? And I think oftentimes for myself and I said other formerly incarcerated people, we get into work, at least I get into work, out of this vain belief that if I do enough right by people, somehow my sins will be forgiven, right?
Mm-hmm.
The world will look at me eye to eye one day if they see me humping and sweating, right? Regardless, in this heat, just like slavery, right? One day they're gonna see me as a whole human, right? And so I understand that question in a very deep way. I appreciate that question being lifted up, and I think that the answer to it is in the walk, right? And that we got to walk with our people towards this future vision, and it's not a sprint. And that our people are reeling from a number of different traumas associated with their pain. And some people mask it with drugs, addiction, whatever. And we have these rigid rules, like you use one time, you're out of here. You know, like that's not even of our nature, right? Our folks we're conditioned, we're in conditioned responses. So we got to be able to walk patiently. And I think patience is part of it. Walking people through their contradictions, right? And walking with them, being on that path with them is important too. But I really appreciate it. The time that y'all had being on this call with everybody, all the beautiful intelligence that I'm seeing resonating through the chat and from all the panelists. So I appreciate the time y'all had. I'll be on for a little bit and then I'll have to jump.
Okay, so Richard, before you leave, there's a couple of folks who are asking where can they get the life kit? So if you can just share that before you jump off.
Okay, I shared the link to the life kit in the chat, and
Mm-hmm.
you can follow us on Twitter at Eat Chicago. And people I get a lot of like restaurant ads and stuff. It's interesting, but I think it's because of the Eat thing. And then Eat.org Chicago is our Instagram, and our website is www.eatchicago.org, and you can check us out there as well.
Thank you.
Thank you.
Your last words definitely resonated with me, and I want to get Gina and Rosette's sort of thoughts around this, about how we keep doing the work, and so we are helping our community in that we're dealing with trauma, and we might be coming to the table with our own trauma. So what are the ways in which we as individuals who are on the ground doing the work every day, walking patiently with people as they go through their own journey, and at the same time fighting these politicians and these systems that continue to create havoc in our communities? What are the ways in which we're taking care of ourselves? How are we taking care of ourselves?
I'm not. I can be honest with you, I'm not. Before this whole lockdown thing, I would walk every now and again. I was eating a lot better. It's horrible right now. And I know it's a lot of my trauma. I know it's all of my pain. I'm eating my way through my pain. Richard was talking about incarcerated and formerly incarcerated. My son was released during this COVID thing, and he was gone almost 7 years. So now I'm adjusting to that on top of this, and we're stuck in a house together. And Richard's laughing. So you know how that is going. But I am a firm believer in self-care. So I preach it to other people. I just have to practice it. Before this thing, I was in therapy. I need to get back in therapy when this is over. I have to take care of me. I cannot put your oxygen mask on and I put mine on first, because I'm gonna pass out and then we're both in trouble. So I need to learn how to take care of me better.
First of all, thank you for that truth and that honesty, because that's what we need in order to think about how to get through this together. I see you, Richard. Thank you. And we'll be giving out people's information around their organizations and the work they're doing as a follow-up email to everybody. But I really appreciate you all's truth and honesty. Folks are in the chat saying, what they do. They do prayers. They're part of a group that prays together. Folks are saying they do a little exercise. They watch a lot of comedy and movies to decompress, read a book. But definitely, I think the first step is acknowledging the fact that we need to take care of ourselves, because we ain't gonna be able to take care of ourselves, take care of our community if we're not taking care of ourselves. And one thing that comes to mind is Audre Lorde Mama Audre Lorde talks about self-care as revolutionary, right? Self-care is revolutionary. Um, and it's important that we stop and take care of ourselves, because that's the only way we're going to be able to fight the good fight, what we need to be doing. So thank you very much, you all, for sharing that. I have one more question that came up that's around mental illness. Um, are you all seeing, what kind of issues are you seeing around mental illness? Are you seeing, are there ways in which your work is supporting individuals to access mental health services, or sort of what's the landscape happening in your state?
We have very few mental health services here for the general public. We have more for people living with HIV because the community-based organizations and FQACs have mental health there. So people can access it, but it's just a case of now you can't get out. I've been seeing on Facebook and different places online therapy. So I think that I need to really let people know that that's something that's available to them if they need it. Because we know people are breaking, this is hard. This is not an easy journey we're on right now. And I just want us all to come out better.
Are you seeing that because you spoke about rural areas that are really being impacted in the South, are you seeing any challenges with telehealth? And if so, are there ways that people are trying to minimize those challenges so services are getting to folks?
Well, really and truly, we're learning from the rural communities about telehealth. Because not everybody's doing telehealth, right? So they had to go to the people who are already doing it and pluck from them. I haven't had any, like I said, real conversations with our people in the rural areas because of lack of, telephones and internet access. But the few people we have spoken with, they are doing different things to make sure that they're addressing their mental health issues, whether they have bipolar or schizophrenia or whatever, just depression, making sure that they're staying in touch with their therapists and getting whatever medications they need.
Thank you. Rosette, what are you seeing happening?
Well, in my community, mental health is kind of not a thing to them. So it's not a priority really. Even when you see people who might use some of that, they're like, so it's a challenge. It's a challenge. That's another new thing we need to introduce to our community and let them know it's okay to seek mental health services.
Thank you. So we're close to the end, and I wanted to, I missed a question. There's a particular question about undocumented individuals. And this person was specifically asking about New York, but maybe Rosette, you can share about some of the resources that are here in Massachusetts for undocumented individuals, and maybe this person will be able to research and see if there's something similar in New York. Can you talk a little bit about how you're connecting undocumented individuals to resources?
Yes, the organization that we have been working with is called Matahari, and I can share that information so you can share to everybody. But it's the one that also came up with a fund to give undocumented individuals who apply, I think something like $300 or something like that, or 600, I forget what it was. But they have done so many things, including immigration, trying to help them with legal fees and things like that. So I'll definitely share that so you can share with the group. But Matahari is the one which comes to mind. And I'm pretty sure they have something in New York.
Thank you. And I want to uplift, a lot of folks are sharing some amazing resources in the chat. We'll definitely, when we send out this recording, make sure that the chat is connected to it. I mean, there's resources being shared about mental health services. There's research sources being shared about undocumented individuals. And of course, I have to, amplify again the way that folks are talking about self-care and coping with their own challenges, as well as working in the community and dealing with of trying to urgently respond to what's happening in their own communities. So we're going to close, and I want to close by asking our panelists if you can share one action step that you would encourage everybody to do, something that folks can, get off this webinar and do right now. They can do in their own communities. Like I said, we've been talking often in our past couple of webinars around challenges, around what states need to do, what needs to happen in communities. And people have really been asking, we need to know what to do. We're in a moment of urgency. Family members, friends are dying, folks not having access to testing. And so we need to know what to do. So I want to ask if you all can offer 1 or 2, 3 action steps that folks can do once they leave here, they can implement in their own communities.
I would say definitely you need to do something. For sure, you need to do something. I want to believe that somebody, like all of us have seen or heard of somebody who is infected or affected by COVID by now. And maybe if you know that person, try and find out what other challenges they had before whatever, could have been housing, could have been food, could have been testing, transportation, whatever it is that they might have. Pick one. Go to a place you think, if you can't be part of, finding a solution to that, go to some other place. I know somebody was saying churches always have resources. True, might not be money, but could, they have people that they can ask for help. And I'll share. When we first, even before we got the problem of housing, I foresee that it might be a problem in our community based on what they were talking about the disease doing and knowing the kind of accommodation in the community. I knew for sure time will come when we'll need help somewhere else. So to put up people who are infected or recovering. And I approached a non-Black church and I put it out there. I didn't know how many people. I'm like, I know, but we can work on it as as time goes. I think when these white folks went and discussed among themselves, whatever it was, they came back and said, well, because actually I was asking for their church space so we can set up their church, since nobody goes to church. So we can set up that space, with maybe air mattresses or whatever, so people recovering can go there as they wait to go back home. So they came and said, well, we really can't do that. They decided not to do that. But they offered to help the group meet expenses of putting people like that up, maybe in a hotel or any other kind of arranged accommodation. And that was a good thing. I didn't know how it would work out, but actually we went back to them and we said, we have incurred this and this, and they were good on their promise to help. So I'm just saying, you never know what you find when you go to us, but I think it's a good thing to ask. I would say put yourself in the position to help and only go and ask. If you go and ask that way, people will see how genuine you are and they'll be willing to come in and join in the help. That's what I said. I wanted.
Thank you, Rosette. Gina, you want to offer words of action and encouragement?
Yes. The first thing I would say to do is find out where your governor stands on these issues. And if it's in a complete opposite direction for where you stand, call them and let them know how you feel. Get other people to call and say how you feel, how you all feel. Another thing I would say to do, thinking about what Richard said about us doing things for ourselves. After this, you go home, look in your cabinets, and whatever canned goods you know you're not gonna use, pack them up and take them to a food bank or church somewhere where someone in need can get it. We do have to start doing for each other and doing for ourselves. And I think that's one of the best things we can do at this point, is to look out for each other in that way. And thank y'all for having me on this.
Thank you to both of you all. Thank you to Richard. I've truly enjoyed this conversation. It really uplifts the power that we have in our own community, and the need for us to tap into that power, rely on each other, and do something different, do what we know needs to be done, right? And that's really based on us working together. Nobody can do it by themselves. We all need to work together. The problem is big, but we can tackle it and do something. So I want to say thank you for joining us. Our upcoming webinar will be happening in 2 weeks. It will be focused on dealing with the historical trauma that's happening in Black communities, and how does that link to the currently what's happening around COVID-19. So please look out for our next webinar. Again, this is Conversations on COVID-19 in Black communities. It is sponsored by the Multicultural AIDS Coalition, Black AIDS Institute, House of Blahnik, Harvard University CFAR, and Southern AIDS Coalition. And we thank you again for being with us this afternoon. Everybody have a good rest of the day.